So in this next video session, what we will address is general principles for what to do if you have diabetes and you get sick. Illness, such as, let's say, a pneumonia or a viral flu, or even simply a cold, can actually make you more resistant to insulin and can cause the blood sugars to go up. Because of that fact, some basic guidelines for you to follow is that when you are sick, you need to monitor your blood sugars a lot more often than when you're not sick. Somewhere between every 2 to at least every 4 hours. And what you want to do is you want to stay in really close contact with whoever your diabetes professional is, okay? Especially if your blood sugars are going above 20. You should call your family doctor, your endocrinologist, or if you can't reach them, the endocrinologist on call. Some general principles to follow is that when you're sick, you need to hydrate better. Ways to hydrate is through drinking water, or things like diet ginger ale, for example, which still can soothe your throat because it has the bubbles, but it doesn't have sugar in the fluid itself. As a general rule, you want to drink enough so that you're going and urinating frequently, and when you look at your urine, it's nice and dilute. Some general principles to follow is to drink between half a liter and a liter of fluids per hour. So the key messages of managing diabetes when you're sick is to check your blood sugars more often, hydrate well, and to stay in close contact with your diabetes professional. Now what I'd like to address is what to do if you have type 2 diabetes and you have an illness where you're able to eat as normal, but you have a fever and you notice that your blood sugars are rising, okay? In this situation, you would take your normal medications that your diabetes doctor has prescribed for you as per usual. You would hydrate well, as we mentioned in the earlier video, and contact your doctor. What becomes a bit more challenging is if you have an illness where you have a lot of vomiting or a lot of diarrhea. Vomiting and diarrhea can cause dehydration. And with dehydration, even though you're keeping up on your fluids, there are some precautions you want to take. If you're becoming dehydrated, there are some safeguards that we need to make sure of because the kidneys might not be working as well as they would under normal conditions. So one thing we want to do is eliminate any medications that can actually make you more dehydrated. And one of the drug classes that should definitely be stopped in this situation is any of the SGLT2 inhibitors. Here is a list of the SGLT2 inhibitors that you will stop. If you're on Forxiga or dapagliflozin, you will not take them when you're sick. If you're taking Jardiance or empagliflozin, set that aside. Same with Invokana, which is called canagliflozin, okay? So if you have vomiting or diarrhea, set these medications aside until you have your kidney function rechecked by your family doctor or your endocrinologist. Another medication that we need to talk about is metformin, or any medication combination that contains metformin. Metformin does not make kidney dysfunction worse, but in the setting of kidney dysfunction, it can accumulate. And we don't want that medication accumulating because it can make you feel quite sick. So if you are taking metformin and you have vomiting or diarrhea, stop metformin. A caveat to that is sometimes some of the DPP4 inhibitors that your diabetes doctor might have you on also contain metformin in combination with the other medication. So for example, Jantadueto is a combination of linagliptin and metformin. So because it contains metformin, you will set that medication aside. The same is true for Janumet, which contains sitagliptin and metformin. So you would put that on hold. And I don't have it with me, but Combigliza is a combination of saxagliptin and metformin. So if you're taking that medication, also temporarily set that aside until your healthcare provider can ensure that your kidney function is good enough for you to resume those medications. So keep in mind, this can be confusing at times and can be challenging, so please refer to this video about what to do and do not hesitate to contact your healthcare provider.